Very good morning, friends. Good morning to all of you. My name is Dr. Prashant Dahire, and I am preventive medicine specialist from Maharashtra, India. And I am on mission to inspire people to achieve health, wealth, and happiness. So, guys, we welcome all of you to this new and fresh Facebook Live. So, today is a special interview, guys, and it's my immense pleasure to introduce you one of my favorite functional medicine health coach, that is Jennifer Allen Newton, to our show, guys. So, welcome, Jennifer.
Hello, thank you for having me. It's nice to be here with you.
Yeah, thank you, Jennifer, thank you. So, guys, I will introduce first Jennifer Allen Newton. So, she is a functional medicine certified health coach and graduate of the Functional Medicine Coaching Academy, where she received her training in health coaching, then functional medicine, and positive psychology. She is also certified in hard math. Jennifer works with clients to support them in setting, achieving, and maintaining their health and wellness goals in a way that is tailored to their unique body, mind, spirit, and situation. Jennifer helps clients to transform stress and tap into their strengths to overcome obstacles and stay motivated to reach to the wellness, guys. So, guys, I welcome all of you and I welcome Jennifer to this show, guys.
Thank you for having me. It's nice to see everybody out there.
Yes, thank you, Jennifer. And actually, before starting the actual interview, so I want to tell you guys my experience with the Jennifer. And Jennifer is a very fantastic functional medicine health coach. Means I had coach Jennifer coached me. So I had done near about 10 coaching calls, functional medicine coaching calls from her, guys. And my first coaching call was done on 26th of January 2017, guys. And from January month 2017, I had done near about 10 coaching calls from her, and she's very fantastic. She helped me a lot in lots of in areas in my health, guys. She helped me a lot in my I'm struggling with nutrition as well as stress management. So she helped me to come out to all the obstacles that I am facing, guys. Also, the gym ball that I am daily doing my Facebook live, guys. So this gym ball, I'll just show you. Yes. So this is the gym ball that I used to I use this gym ball daily in Facebook lives, and this gym ball was suggested by Jennifer Newton that you should use this gym ball to improve your motivation. Yes, Jennifer is also sitting and present on the gym ball, guys. Yes, and also 7-minute workout. That 7-minute workout very fantastic. I learned a lot. That 7-minute workout, then gym ball. Also this wheel of life, then wellness map, then lots of plans, that is cardio metabolic plan, detox plan, diet plans, all the things. Gratitude journal, it is the very complete new thing for me. And Jennifer taught me how to write gratitude journal and what is the importance of writing that gratitude journal. All these new things she taught me, and I got immense help in my all the areas that I was struggling, guys. So, guys, it's my very much pleasure to introduce you, Jennifer Newton, to our show, guys. So I welcome Jennifer. Jennifer, I welcome to this show.
Thank you. Thank you for saying all of those kind things. I'm so glad that you found our sessions helpful because I thoroughly enjoyed working with you. It was a
Yes.
blast.
Yes. Thank you, Jennifer. So, Jennifer, actually my intention today was to introduce all the audience from this India. That I will what is mean by functional medicine? Can you tell me means what is this functional medicine concept to all the audience?
Sure. Well, functional medicine is really a lot about function and how your body functions, underlying causes of disease and disorders in your life. So, functional medicine, instead of just looking at something that's wrong and treating the symptoms of a disease, functional medicine is very involved in looking at what is upstream of that. So, what are the potential causes of that? So it looks at everything from your genetics to your lifestyle factors to the amount of stress in your life, the types of relationships, and all the different things that have to do with your wellness. And so a doctor that's working in functional medicine might be working with a person who has a chronic illness, who has maybe several different things that they're taking medicine for, that they want to, say, reduce their blood pressure, or they want to lower their cholesterol, or become more fit, or if they're pre-diabetic, a functional medicine doctor might work with them to try to understand what they can do to lower their blood sugar. So functional medicine is a very important form of medicine. I believe it's the medicine of the future because it is also very integrative. It looks at the whole person and how all of the different systems within your body work together and how they function. And it also looks at your body as well as your mind and your spirit and how all of those things come together. So it has a lot of aspects of traditional medicine combined with Western medicine. And that's why I believe it's the medicine of the future. As we face so many chronic and complex diseases now, it's not just, if you have appendicitis, you need to have your appendix taken out. But if you have chronic high blood pressure, then there's something else that you can do to try to reduce that. Probably many things that you can do related to your diet and lifestyle. So a doctor like you, who is working in a functional and integrative practice, would potentially work with a patient, potentially refer that patient to someone like me as a health coach. And then my job in that process is to work with the person to help them figure out what their goals are, and to break those goals down into specific activities that they can do to provide information and background, and to help them achieve the goals that perhaps their doctor has set out for them, or that they may just want to achieve personally.
Yes, yes, rightly said, Jennifer. Means functional medicine is a branch for the future, for the 22nd century. And you rightly mentioned that currently means doctors are only focusing on the signs and symptoms. They are treating just signs and symptoms, but they are not means looking at the all that factors that are responsible in the causation of disease. And it is means with the help of this functional medicine, then we can means rightly focus all the factors that are responsible in the causation of disease. Thank you, Jennifer, for means explain. Actually, that the book that you sent me, that is a functional medicine book, that was a very fantastic book, and I am very grateful that you sent me that book, Jennifer. And I read forward written by that Dr. Mark Hyman, and he is the director of that Cleveland Clinic. And means I am very much impressed with that just forward. In that means Mark Hyman means he in a very effectively he written the need of the functional medicine.
Yes, he's wonderful. And he really captures so much of what's going on in functional medicine. And one of the things that I really love about functional medicine is that it's very forward looking. It not only looks back at what happens with you personally, so perhaps something in your history, how you grew up, what's in your genetics, how you eat, and how you behave, but it also is very involved in research. So understanding what are some of the latest, some of the latest information about how food affects our bodies, about things like epigenetics, which is a very new field that looks at how your environment can interact with your genes and make you sick or make you well. And a lot of functional medicine and doctors that work with it, and coaches like me that try to help people make the diet and lifestyle changes, the goal is to help people turn on good genes and turn off the bad genes, so to speak. And so much of that is regulated by food. So they're on the front end of a lot of that research about what's going on in genetics, as well as in how food affects our genes, how exercise, how stress, all of these things can affect our health.
Yes, yes, really, really fantastic concept. Epigenetics, it is completely new, Jennifer. And turning off the genes, turning on the genes. This is completely new concept for all of us, Jennifer. Thanks a lot for explaining, Jennifer. And how can you tell us how this functional medicine can help us?
Sure. Well, I think, for functional medicine, for the average person, it could be anything from trying to set forth, like if you don't have any health problems, but you're concerned perhaps you have a family history of heart disease or diabetes, and you want to avoid that. Functional medicine and working with a functional medicine doctor and a coach can help you make changes in your life today that can help you avoid the types of health problems that may be running in your family. Also, if you have problems, they tend to find clusters of problems. So a person may have headaches, chronic headaches. They happen all the time. And they may have some other issues that are, don't seem like they're related. Your functional medicine doctor would work with you to try to figure out how those things might be related. Perhaps it's related to a food allergy or an intolerance or something that's bothering you in your environment. So the role of your doctor in helping you in functional medicine would be to be sort of the detective with you, to work with you and ask you lots of questions and figure out what's going on. And then the role of your coach would be, once your doctor has helped you figure out how functional medicine can help you, whether it would be about your lifestyle changes or changing the way you eat, or maybe dealing with some of the challenging relationships or stress in your life, then your coach is the person who helps you walk that path. So your functional medicine doctor may say, okay, this is the journey for you based on what we've discovered. Here's where we want you to be in 6 months or a year or 5 years. Your coach is the person who walks on the path with you, who helps you make that journey, provides you with the information to help you stay motivated, to work with your character strengths, to help you realize that the power you have within yourself to make these changes to heal yourself.
Yes, yes, yes. Really, really fantastic one, Jennifer. And actually means we need both doctor, means functional medicine doctor, as well as functional medicine health coach. Actually in India we heard the coach for sport, means coach for various sports, but health coach, it is a completely means new concept for us, Jennifer. And if we work along with this doctor plus coach, and if means doctor and coach both they work, means to relieve all the symptoms, signs and symptoms that patient are suffering, it will be really helpful. And you rightly said, Anushri Ladke, she is saying that whether this functional medicine and functional medicine coach, whether they will help us to means deal with depression and pre-diabetes.
Well, the type of functional medicine that I've learned through the Functional Medicine Coaching Academy, they don't just teach us about the basics of functional medicine, but they also work with positive psychology. So that's the difference in coaching. Coaching psychology is more, where you may go see it's different from seeing a psychiatrist or a psychologist or a mental health professional, although we can work with them. Again, they're the type who would be more likely to diagnose what is going on with you or do therapy with you. A coach can help with things that involve your day-to-day life, like starting from today. So positive psychology assumes that you come to me as a whole person, that you have everything that you need within you to become the person you want to be. So it has a lot of aspects of life coaching to it, and motivational coaching. We listen, We hear what you have to say. We ask questions. We're trained to work with you in a way that helps you uncover what your underlying character strengths are, so that if you're like in a relationship that's having struggles, or if you're trying to figure out what you want to do with your life, or you're trying to figure out your purpose, or you're just working on some motivation issues, that's something that as coaches that we're trained to help with. And again, we're walking with you on that path. So I have a health coach too, who was also trained through the Functional Medicine Coaching Academy. And sometimes when I talk to her, it's because I want to embark on a new project. And I get stuck. I don't know what to do next. And she doesn't tell me what to do. She asks me questions, gets me thinking about things, and then I'll think about them on my own over the next week, and suddenly I'll have an idea. And that's where the coach helps kind of get you going. If you have a complex illness like prediabetes, you would need to have that diagnosed by your physician. And your doctor may not be a functional medicine doctor, but they may tell you, oh, you need to cut out the carbohydrates in your diet and not eat so much sugar. But the doctors don't usually tell you how to do that. So they may send you to a nutritionist who would give you specific dietary advice, or they may send you to a coach like me who can work with you on certain plans that your doctor may have told you. So if your doctor says, I want this person on a low carb plan, as a coach, I can work with you and help you understand, like, what are some foods that you could fix that would be tasty? What are the things that you like? What kinds of food gives you joy? So it isn't just you're being deprived of something that you want. So my job as a coach is to keep you motivated to make those changes in your diet if that's something that you want to do.
Yes, yes, rightly said, Jennifer, and it is the need of the future. And actually doctor means they are means every means there is not means lack of information. Every patient means everyone knows means there is huge information over the internet in books. Doctors are also providing information, but this thing that motivation means health coach. That means it is the need of the future, and you rightly explain why this health coach is needed means for us. Thank you, Jennifer. And actually, I want you to ask Miss personal question. My third question: why did you decide to become a functional medicine certified health coach?
It's kind of a long story. Uh, it starts with an airplane ride many years ago, probably 12 years ago or more. I was on an airplane going from where I lived in Oregon up to Seattle for a meeting, because my career has been in communications and public relations, and I do a lot of work with software companies. And so I was on a business trip, and I sat down next to Dr. David Jones, who was at the time the president of the Institute for Functional Medicine. And my mother was very, very ill at the time. And he and I had a great conversation, and he told me about this functional medicine. I had never heard of it before. And fast forward, I ended up getting my mother hooked up with a functional medicine doctor who found out exactly what was going on with her, and a disease that she'd been fighting with many drugs for several years. He had her completely off the medication and healed within a month, because they were treating the wrong thing. She had an underlying problem that wasn't being addressed. Once they addressed that, she got better. I also experienced functional medicine firsthand by being there with my mom. Ended up doing some work with the Institute for Functional Medicine. Eventually, they invited me to be on their board of directors, and I was honored to serve on their board for 8 years. The Institute for Functional Medicine is an organization that trains doctors and nurses and other practitioners how to practice functional medicine. So I've been to many of the doctors' trainings, but I'm not a doctor. But because I was on the board, I was involved. And then after 8 years on that board, I was introduced to Sandy Scheinbaum, who is one of the founders with Elise Wagner of the Functional Medicine Coaching Academy. They had just started this new school to train health coaches in functional medicine, taking a lot of life coaching training and health coaching training and adding the functional medicine and positive psychology aspects to it. And so they invited me to be on their board. And I said, sure, but I would like to know what this coaching is all about. So I decided to take the classes. So I went through the 1-year program, and I absolutely loved it. So I said, you know, perhaps this is a new future for me. And as a part of the program, I had a practicum, and one of my practicum clients was Dr. Prashant Tahile. So I was very excited to work with him. And he helped me learn how to be a coach. So I have to say, I appreciate that very much as well, having the opportunity to work with you. And that's really what brought me here, is just, I kind of came at it from a different direction. And now I just really love working with people. And I love the idea of helping change people's lives, helping people change their own lives for the better.
Yes, really, really inspiring story, Jennifer. Means it's really means just listening to your story, lots of people may inspire. Very inspiring story. Thank you, Jennifer. Those who join new to this Facebook Live, guys, I am with Jennifer Newton, functional medicine health coach. She is a certified functional medicine health coach, and we are doing this interview on lots of aspects, guys. So those who are watching live, they can share this Facebook live on their Facebook wall, guys. Those who have shared, they can type SHARED, shared button, and just type in the comment box. Those who are sharing, so they will get 10 minutes of coaching call from me, guys. So just share it on your Facebook wall. So Jennifer, it's really an inspiring story to know that you involved in this functional medicine branch, and now you are enjoying how to inspire lots of people with the help of functional medicine. Very fantastic, Jennifer. Thank you. And my fourth question, Jennifer, what does a health coach do, and how it is different from doctor, therapist, or nutritionist?
Well, the role of a doctor or a therapist or a nutritionist is prescriptive. That means they're trying to figure out what is going on with you and prescribing you a way to deal with whatever that problem is. So if you see a doctor, it may be a prescription for a drug, but it may also be, if it's a functional medicine doctor, a prescription for a change in your lifestyle, your environment, your stress level. So they're practitioners, and a coach is someone who doesn't necessarily prescribe anything for you. In fact, that's not really our job at all. Our job is to work with you to understand how to help you get from where you are today to where you want to be. So if that has to do with your health, then we look at the information that may come from your doctor or your therapist or your nutritionist and say, okay, so I have all this information. How do I make this work in my life? Sometimes it's hard. Someone just tells you to change your diet or to exercise more or to reduce your stress. How do I do that? How do I make this fit into my crazy, busy day-to-day life? So that's where the coach comes in. I work with you to help you identify your goals. We'll help you break your goals down into doable chunks if that's something you want to do. If you're a person who just likes to set an intention and wants a lot of information to help you make decisions about what you want to do, we're there to help provide information and background for you. So we won't be prescribing anything, but if you're interested in a subject, we may send you articles or information on recipes or diet plans that may be of interest to you. And then if that's something you want to do, then we can help you with that. So usually I'll work with a person online. We work with video. Oftentimes it's just with telephone. And I wasn't sure how that was going to work. And Prashant, you were my farthest away client. And it works just fine. You can see each other and have a conversation. And it's wonderful because when we work with our clients, like when I work with clients, I start to think of them as friends because we learn a lot about each other. I get a chance to sit and listen. I don't usually talk this much when I'm coaching, as it's all about you and listening to your story and helping you. Sometimes when you tell your story, you share things that you don't even know yourself, and I can share that back to you. And aha, there'll be some sort of a realization. So that's what my coach has done for me many times over. And that's what I love about coaching, is it's really about helping you stay inspired and motivated. And we can give you some compassionate accountability. That's the other thing. If I know that I told my coach a little over a year ago, my student coach suggested, like, I was wanting to find a new way to stay fit in the wintertime when it was cold and dark. And she asked me if I'd ever gone to a yoga class. And I said, oh, I went to yoga like a dozen years ago, but I didn't think I could do it anymore because I'd hurt my shoulder. And she suggested that I interview some yoga studios and find a yoga studio that will work with a person who had an injury. And because she asked me if I was going to do that, she held me accountable. She said, okay, next week when I talk to you, I want you to tell me how the calls went with all the yoga studios that you're going to talk to. And I thought, oh, well, I better do that because I promised my coach that I would. And now here I am a year later, I'm practicing yoga all the time. I absolutely love it. It's changed my life. And it's all because she held me accountable from one week to the next. Okay, you're going to call those yoga studios and you're going to find one that you like, right? Like, yeah. So thanks to my coach.
Yes, really, really, this is the need of the future, as this means chronic diseases, means this chronic condition. They have lots of burden on all the means countries, all the communities, even India. It is also means India also facing lots of challenges with the chronic diseases. And now this move from infectious diseases to chronic diseases is going rapidly. And means as this chronic diseases having lots of different etiology, and means this clinical approach is not able to control these diseases. And this is the need of the future, that we need coach, those who can means those with the help of coach we will be accountable, and we will be means moving daily little ahead, one step ahead towards our achieving health goals. Really, thank you, Jennifer, for means explaining the role of coach in means maintaining our health. Thank you. Thank you. Thanks a lot. Then Jennifer, how this means real means actually this how means health coaching will help us, means what are the different areas that you will means focus, means how this health coach will help us.
Okay. Well, some of the areas that we may explore with you might have to do with your nutrition. So it might have to do with how much water are you drinking? What types of foods are you eating? Are the foods you're eating helping you? Do they make you feel good? Are there certain things that your doctor or health professional has told you that you need to change about your diet, and working on those things? Sometimes it's a person who just wants to lose a little bit of weight or get a little bit more fit. We're not the same as a fitness coach, but what we can do is share information with you. And many times a health coach is also a fitness coach or a nutritionist, and people who have those specialties will be able to work with you on very specific things. But for example, with me, and since you brought up this issue earlier, Prasant, you said, I want to exercise more, but I don't have enough time all the time. I'm very busy. You've got your work, you've got your family. How am I going to squeeze in a workout? And I shared with you some information about high intensity interval training and the very short 7-minute workout. Now, this is something that I recommended. You may want to, being a doctor, you might be able to talk to yourself, but if it was a person who wasn't sure about their fitness level, I might say you might want to talk to your doctor first to make sure that you are ready to do an exercise program. But then, if that's the case, can help you find an exercise program that works for you. So if it's doing 7 minutes of high intensity interval training or 10 minutes, and you can fit that into your day, then that's something. With a lot of people, it's just getting out for a walk, or maybe trying yoga or something like that. And sometimes it's just about movement. Sometimes, when I was coaching Prashant, he saw me I was bouncing and I didn't realize that I was bouncing. And so I apologized. I said, oh, I'm sorry, I'm bouncing. It's because I'm sitting on a ball. And he's like, you're sitting on a ball? Yeah, because it helps with your balance. It helps you to incorporate a little bit of movement in your day. It keeps you from sitting at your computer like this, which has been my problem for a long time because I do a lot of writing. And so, you know, those are little ways you can get movement worked into your day. So as a coach, I might help you figure out what works for you in terms of getting more movement, not necessarily having to go out for a run and get all sweaty. You might just be able to move a little more in your office. It helps. Every little bit helps. We also can help people with sleep to some extent and relaxation. I remember one of my prescriptions for you, Prashant, and I don't do prescriptions except for this: go have more fun with your family. That's one I feel safe to prescribe. Most people could use a little more fun. So we may help you figure out, what is it that brings you joy in your life? What are the things that you enjoy doing? What's going to make you happy? And helping you think about those things and focus on those things a little bit. And then one of the things that I think is super, super important, because it tends to be, I think, the underlying thing under many other problems, is stress. So many times if you're stressed, it's very hard to eat better, because when you're like when I'm stressed, I just want comfort food, and comfort food is not usually the best food for my health. I could sit and eat a huge chocolate bar or something like that. A little square of chocolate would have been fine. So I believe that if you help someone deal with their underlying stress, many times a lot of the other things become easier to do. So if you don't have any time to work out, it may be a sign that you're overprescribed in your day. So maybe that's something that we need to look at. I also do heart math, and I work with people on mindfulness. So things like the gratitude journal, which, you know, all of the things that we do, that's, I should mention, in functional medicine, it's based on science. It's not just kind of, you know, the woo. It's really based on solid science. And it may sound woo-woo to some people, but it's the real deal. And things like heart math and mindfulness are techniques that you can do to calm yourself, different breathing techniques that we learn. So you can calm yourself in a moment when you're stressed out, but also learn some techniques to just de-stress at the end of a long day. And that can help with your sleep. It can help with your digestion. It can help you stick to your exercise and diet programs. So helping people deal with stress is one of the biggest areas that I work with people on.
Yes, 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 really, really, and I got lots of help on all these sectors, and I use this heart math, I use all the gratitude journal, every aspect that you told, I experience, and now you told me to write this gratitude journal twice a week, and now I am writing daily, because after looking at the benefits of writing twice a week gratitude journal, I am now daily writing my gratitude journal. It means
Great.
really helping a lot to remove negative thoughts from my mind, and I'm always be grateful to you, Jennifer, for introducing me all these aspects of important aspects of life. And thank you for explaining the importance of health coach for us. Thank you, Jennifer. And tell us what are the main strategies that are used in functional medicine coaching. What strategies, on which base this coaching is used?
So your functional medicine doctor or other practitioner may be telling you to use, you know, food differently. So if you're, for example, you are pre-diabetic, there may be a discussion about how do you lower your blood sugar with food. There's also a lot of information and science around things like phytonutrients. And so as a coach, what I might help you do is eat a rainbow every day. So what does that mean? That means foods that have different colors have different nutritional properties that can be very good for your body. And so I can help you figure out ways that you can get more colorful fruits and vegetables into your diet, even if it's a matter of sending you my favorite recipes or talking with you about what you like to eat and how you might be able to change that up. So that, so diet is a big part of it. Also, the environment is a very big part of functional medicine. So a functional medicine doctor might be looking at how your environment might be affecting your health. It may have to do with your work environment. It may have to do with the stress in your environment, but also just the products that you use every day. There are a lot of chemicals that are in our shampoos and our soaps and the makeup and all the personal products that we use. So if it's determined that a person has some toxins in their system because of things in their environment, as a coach, I can help you do things like figure out less toxic alternatives to things. So maybe different types of soaps, different types of shampoos and makeup that doesn't have as many of the toxins in it. So that's where the coach and the doctor would work together. Again, with the exercise and movement, frequently a functional medicine doctor may say, well, you really need to find ways to get a little bit more exercise and incorporate that into your day. As your coach, I'm here to help you figure out how to make that work for you, how to make that fit into your calendar, into your busy schedule, by finding out what are the things you like to do. So going to the gym isn't for everybody. Sometimes just being out in nature can make a person feel really good. So as a coach, what I suggest, or offer up or talk to you about might be a little bit different from the standard procedure. So if you're someone who really gets inspired in nature, it will be, well, maybe we do a nature walk instead of going to the gym. And then in terms of dealing with social relationships and stress, I think functional medicine also is working in those areas as well, because they want to look at you as a whole person. And if you're stressed out, you're in that side of your brain that says fight or flight, meaning you're panic. You're either going to run away or you're going to, hide, or you're going to fight. And that's a very, that has a whole cascade of effects on the body chemistry. It affects all of your organs, not just your mind, but how the rest of your body works, because your body's preparing you to run away. So your digestion doesn't work as well because that shuts down. Your brain doesn't work as well because that starts to shut down, because all you can do is just get away from whatever it is that's bothering you. So that stress response is something that is underlying a lot of conditions that people have. So as a coach, part of my job is working with you on techniques to de-stress yourself and what works for you. It's not the same for everyone. Some people love to meditate. Some people can't make themselves meditate. It just requires too much focus. And then there's so many other things that you can do that aren't sitting cross-legged and just saying a mantra. That works for some people. Other people just can't make themselves do it. So what I do is work with you and say, okay, so what works for you? It may be something completely different. Maybe a guided meditation. And then I think one of the things that's a little different with the coaching than would be with your functional medicine doctor is we add the positive psychology, which I mentioned works a lot with your character strengths. So we may give you an assessment to figure out what are your core strengths. What is it that motivates you, that makes you tick? What is it that makes you who you are? Those are the things that are going to help support you when you're making major changes in your life. So I would perhaps give you the VIA Character Strengths Survey, which is available for free at viacharacter.org. Find out what your top 5 strengths are, and then that can become part of the coaching process. So if you have a strength of honesty, perhaps it's talking about, okay, well, if you're honest with yourself, is that donut really going to make you feel better? Those are the types of ways you can use character strengths in many different ways. And a lot of it's about motivation. For me, my number one character strength is appreciation of beauty and excellence. So my coach asked me a couple weeks ago when I was feeling kind of sad, and I just said, oh, I don't know what I want to talk about today. I'm just not feeling very good. And she said, have you appreciated something beautiful today? And I said, no. She says, I want you to go stoke your appreciation of beauty and excellence right now. And so I went outside and I went for a walk and I saw the blossoms on the trees and the flowers, and I took just 10 minutes to appreciate the beauty around me. I felt 100% better because that's my number one character strength. So it's different for everybody. And as a coach, we help you figure out what your top strengths are and how you can use them.
Yes, yes,
So that's a
really,
long
Jennifer
answer.
means I forgot. Yes, yes, yes. You answered perfectly, Jennifer. And means I forgot to mention means in your one of the coaching call means I get to know my character strengths, and my character strengths are means curiosity, kindness. These are the top two character strengths. Love for learning, and means if daily how to implement means how to strengthen this character strengths and how to be happy with the help of this VIA character strengths. I learned from you. Means I got immense help from this character strengths. Thanks a lot, Jennifer.
Great.
Thank you very much. So if someone wants to become this certified functional medicine health coach, then means how to means become this certified functional medicine health coach. Can you tell us, Jennifer?
Yes, there is only one organization that is affiliated with the Institute for Functional Medicine, and that is the Functional Medicine Coaching Academy, functionalmedicinecoaching.org. And they have a one-year program. It's all online, and it's wonderful. You get, I mean, whether you want to be a coach or just learn about how to make these changes in your own life, it's changed my life just going through the program. I said, even if I never became a coach, it was still worth it to go through the program. You learn from some of the top doctors like Dr. Hyman. Most of the doctors that teach the doctors at the Institute for Functional Medicine and the medical education also teach in the coaching academy. So that's very exciting. Plus they add a lot of experts in positive psychology and behavior and motivation, and all different forms of coaching experts that will come in and teach. And then the program also has a practicum. So you get to work with clients, and they have a coaching center where you can go if you can't afford to hire a coach. They have low-cost coaching. You'll get a student coach who is learning how to be a coach, but they've already had most of their training before they start in their practicum. I thoroughly enjoy the program and highly recommend it. I know they have different pricing sometimes if you register early. So if you go to functionalmedicinecoaching.org or look up the Functional Medicine Coaching Academy, they have a lot more information there about the program. And I just loved it.
Yes, yes. Thank you, Jennifer, for giving us information about the functional medicine coaching. My last question to you, Jennifer, actually tell the audience. Suppose all the audience they want to reach out to you. All the people suppose they want to reach out to you for health coaching. So how they will reach out to you?
Okay, well, my company is reachwellness.org. So like reachwellness.org. And I can't type it in right now if I'm on the camera.
Yes. In the comment box, please. Yes. Please in the comment box, please put that reachwellness.org, so that means the audience they can learn more about you and your coaching. Also it means a very fantastic interview, Jennifer, and with your in your busy schedule you had given lots of time, although there is a night. What is the time now in your place, at your place right now?
No, it's late at night. Yeah, it's after 10 p.m.
Yes. In your busy schedule, still you had given time for this interview. Thanks a lot. Thanks a lot from my heart, Jennifer. Thanks a lot for giving tons of information in this Facebook Live. Thanks for joining us. Thank you. Thank you very much, Jennifer.
I'm happy to be here. Thank you for having me.
Yes, guys. So, guys, those who want to means those who got some information through this Facebook Live, please share it on your Facebook wall. And if you shared, please type SHARD shared button. So if you shared, you will get 10 minutes of coaching call. Also, those who want to learn more from Jennifer, they can reach out to Jennifer at reachwellness.org, guys. So Jennifer will type it on this in the comment box. So thank you. Thank you very much for joining with us. Thank you very much for commenting with us. Thank you very much for giving lots of hearts, lots of thumbs ups. Thank you, guys. Thank you. See you. Bye.
Thank
See you,
you.
Jennifer. Bye.
Bye-bye.
Bye. Thank you.
How do I do that? How do I make this fit into